Nursing plays a huge leadership role in pandemic response in the United States. And as nurse researchers, educators, and administrators, we continue to advocate for health equity, as so many of our patients are from communities of color or our indigenous populations. And we have really struggled this year, and I can't overestimate the problems that we have had with absence of national leadership, with misinformation that has been spread through the media and social media that has led to a lack of public confidence in public health and in a scientific response to this terrible, terrible pandemic. So we as nurses are charged with not only caring for our patients, their families, and our communities, but in advocating for health equity and at the same time correcting misinformation and myths surrounding the pandemic. I want to take a moment to talk a little bit about nursing research, because even in the midst of the pandemic, as nurse researchers, we have continued to study better ways of rendering patient care, whether it's proning patients in the intensive care unit or looking at alternative types of personal protective equipment, such as reusable elastomeric respirators. Nursing research continues to move forward to advance science in our disaster and pandemic response. At Johns Hopkins University, I've been privileged to lead the Hopkins COVID-19 Rapid Response Research Program that's specifically looking at healthcare worker protection. How can we do a better job of keeping our nurses and our physicians, our respiratory therapists, our social workers, anyone who interacts with patients safe and well? We're running a number of different studies that are looking at the mental health and social support needs, to access and appropriate use of personal protective equipment, to longitudinal serology studies to try to better understand transmission of this virus within hospitals and clinical healthcare settings. Last week, I had the privilege to speak at an international disaster nursing research conference sponsored by Emory University. I recognized several wonderful faces who also participated in that conference here and our meeting today. And we talked about the importance of maintaining a program of nursing research during the pandemic, and the importance of asking the right questions so that we can improve nursing practice and improve the care of our patients and their outcomes. That these studies are methodologically rigorous, that we secure human subjects protection early on, that we potentially pre-position nurses and physicians to gather and analyze data in real time, and that we build trusted relationships across our community and across our countries to foster future collaboration in disaster and pandemic research, and that we provide technical support to nurse scientists. We are about to embark on our COVID-19 vaccination campaign here in the United States, and that in itself is already proven challenging, as each state is incumbent upon them to develop the plan to vaccinate their own population. This is happening at a time, as I've mentioned earlier, where many of our states are already in crisis situations because of the overwhelming surge of COVID-19 patients. So it will be a challenge for us going forward to simultaneously maintain our clinical operations and our healthcare business sustainability while sustaining our public health interventions and at the same time embarking on a national COVID-19 vaccination campaign. I want to thank you all again for the opportunity to provide you with an update on what is happening within the United States. It's not a pretty picture, and it is definitely we will be looking at the lessons learned on emergency preparedness and response to this pandemic for many years to come. But I'm comforted by my international colleagues and the strength that I draw from so many nurses worldwide, recognizing that we are all in this together. Thank you so much.